There has been a lot of research about polygenic risks for, let's say, hypertension and the clinical outcomes. So we know that polygenic predisposition to hypertension can increase not just blood pressure values, but also the risk for other outcomes, even in participants that do not have clinical hypertension yet. So this is already known, but what was interesting for us to see is how this translates into a clinical application, and specifically into treatment response. Up to 20% of inter-individual variety of blood pressure is attributed to genetics, but we don't really know if this correlates with treatment response as well. So we investigated participants within the All of Us research program. It's a large cohort that is still enrolling, but aiming to enroll 1 million US Americans, funded by the NIH. And all these participants receive full genotyping. So we have available genomic data for all these participants. And what we did is that we calculated a so-called polygenic risk score, which summarizes all the known genetic risk variants for systolic blood pressure or hypertension, which are in total 732 variants that we used to create this risk score. Based on this risk estimation of the polygenic risk score, we categorized the participants in low, intermediate, and high genetic risk, meaning low is less than 20 percentile, intermediate 20 to 80th percentile, and high risk is above 80th percentile. And also, we only included participants that were treated with antihypertensive medication. So we wanted to see how the effects of polygenic risk within this specific group of treated participants is on several outcomes. And the outcomes that we investigated were systolic blood pressure values measured sequentially during the in the follow-up. Then we investigated treatment-resistant blood pressure, which is defined as systolic blood pressure above 140 millimeters of mercury, despite being on treatment, since all these participants were treated. And then the third outcome was stroke within 3 years of follow-up. And then we conducted regression analysis. Polygenic predisposition to hypertension correlated with increased values of systolic blood pressure for all comparisons, so for both for the intermediate versus low group comparison, but also for the high versus low group comparison. Then similarly, we could see that polygenic predisposition to hypertension also correlates with treatment resistance hypertension. And then just to make the statement that this does not only reflect within the blood pressure values, but also with respect to clinical outcomes. We saw that in the survival analysis, there was an increased hazard of stroke during the 3-year follow-up as well. And all these findings were validated in an independent cohort, the UK Biobank, and they were, same. Translation that would make sense within clinical practice would be to use the polygenic risk score as like a screening tool to identify high-risk subjects and maybe address personalized treatment strategies within the future. But yeah, it's one step, and we don't have this full genetic data available at this moment. But since genotyping becomes more and more available and also more affordable, we do think that this will be an avenue to pursue in the future.